I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Friday, January 24th.
Political involvement by KDA members has helped deliver legislative successes in years past. Join us for Dental Day 2014 on Thursday, February 6th in Topeka. Together, we can do it.
Let's start today by talking about fluoride. Of course, last week we were talking about an anti-fluoridation bill. Is House Bill 2372, which was scheduled for a hearing. That hearing was rescheduled to Wednesday, February 5th in the House Committee on Health and Human Services. Now that hearing is going to be held at 1:30 on that particular day, and that's actually the day before our Dental Day activities on Thursday, February 6th. So we would really appreciate the fact or the opportunity for dentists and maybe your staff, if you're interested in that topic, to come into town and be part of that. We know that the anti-fluoridation folks will be filling the room in support of their anti-fluoridation rhetoric, if you will. So we'd like you to come, and we'd like to have the biggest crowd and support that we can opposing House Bill 2372. Now also with fluoride, we continue to hear from local communities around Kansas that are facing the issue of unfluoridating their water. We've just recently heard that Council Grove, their city council, may be looking at whether or not fluoridation should continue. So if you hear of anything in your local community, please let us know. We'd like to be able to assist you and contact folks in order to be part of that. Now, in all these efforts on our part, working with Oral Health Kansas and some other organizations, we've created a new website, fluorideinkansas.org. That's a reference and a resource for those communities and for you when talking about fluoride and what the benefits of fluoride are. So we encourage you to check out that website, be familiar with the facts regarding fluoride. And as another interesting fact, 69 years ago tomorrow, the city of Grand Rapids, Michigan was the first city to fluoridate. Of course, in 2000, the U.S. Surgeon General put fluoridation as one of the top 10 public health achievements of the 20th century. Well, on with the legislature and the Kansas Dental Association issues. Of course, our Dental Day 2014 is on Thursday, February 6th. We hope you can all make it. You can go on our website, ksdental.org, and register for that. You should have a brochure that's been received in the mail as well. So we look forward to seeing you all on Thursday, February 6th. Now, the following week, just for your information, is the Registered Dental Practitioner group. The Kansas Dental Project will be having their advocacy day. Well, they'll be trying to promote the mid-level. So the more people that we can have the week before and talk about the concerns that we have with the mid-level, I think that will be helpful to dentistry in general. Now, with regard to the Registered Dental Project and the mid-level, we know that there have been at least 4 cards that have been mailed to a variety of people around the state of Kansas. Those cards have come from Kansas Dental Hygienists Association, the Kansas Dental Project itself, the Kansas chapter of the Academy of Pediatric Physicians, and then also Americans for Prosperity. Those cards have all been in support of a mid-level. We believe that many of them have been misleading, particularly the card that came from AFP that had their name on it. It talks about the benefits of a mid-level to a dental office and allowing a dental office to grow and treat more patients, and how the public should be supportive of a mid-level in order to assist dentists in order to better treat patients and provide access to care. Of course, kind of the tone of that particular card indicates or implies anyway that the Kansas Dental Association or dentists at large are in favor of the mid-level bill. Of course, that's not the case. So we encourage you to talk to local people and your legislator to let them know, of course, that the Kansas Dental Association and you as a dentist do not support a mid-level or the Registered Dental Practitioner Bill. Of course, right now we feel like the biggest access to care issue we have is the fact that CanCare it continues to be bogged down with those managed care organizations. Generally, we're hearing more complaints from DentaQuest, but their ongoing increase in the number of procedures that have to require a prepayment, denials, and just really the lack of payment based on denials that in the judgment of someone at DentaQuest is not considered to be medically necessary. Yesterday, the DentaQuest Dental Advisory Committee met. I attended, as well as some dentists and other folks that obviously were concerned about that and expressed our concerns. We're hopeful that there are some changes maybe in the works down the line. Only time will tell on that. And we'll continue to discuss that with the administration and with others in state government with regard to our concerns, and you're all concerned about the way CanCare is being administered in our state. Kansas Dentistry's biggest access project, the Kansas Mission of Mercy, that's put on by our Dental Charitable Foundation, is fast approaching. Registration is available right now on our website, so if you haven't already registered for that, please go on our website and do register for the Kansas Mission of Mercy. This year will be in Dodge City, February 28th and March 1st. Just earlier this week, Walmart had a statewide press conference to announce as many as 12 different charities that they were providing funds to, including the Kansas Mission of Mercy. Dr. Rick McFadden, the local arrangements chair in Dodge City, he drove to Topeka in order to meet with us and receive a check that looks exactly like this one, that celebrates, of course, Walmart's commitment to the Kansas Mission of Mercy, and we appreciate their support and hope that they will be supportive of future Kansas Mission of Mercies as well. We did cover the story of the Walmart presentation, so for more information, visit our website for complete details. Finally today, I'd just like to report that later today, both our Executive Committee and our Council on Finance and Budget will be meeting here at the office. We'll be looking at the budget for 2014-15 and making recommendations on strategic planning and other issues that the KDA, of course, will be facing. Now, that budget will be forwarded to our Board of Delegates that will be meeting on the afternoon of Thursday, February 6th, following Dental Day in Topeka. So again, if you're on the Board of Delegates or have any interests that you would like to express to your local delegates, please let them know so that they can bring those forward to the entire board. With that, thank you very much, and we'll be talking with you next week.